most important and most difficult to understand. When it comes to potassium and calcium, a little more easier to deal with. So for this webinar, I have chosen hyponatremia, and there's a lot of difference between what you read and what you practice. So I tried to bridge the gap. Okay, so we'll try to see whether we can put some of the concepts into practice so that we get more practical tips, like how to deal with a patient who actually has hyponatremia. So first I will introduce this topic with the 3 cases. And towards the end of my lecture, we're going to discuss the answers to these 3 cases. Hopefully the answers will be straightforward after you have listened to the lecture. So case 1, 40-year-old man has severe diarrhea and vomitings of 3 days duration. He has reduced urine output and blood pressure is on the lower side, 90/60 when he comes to the emergency room. He's alert and oriented and he looks dehydrated. Tongue is dry. And on labs, he has sodium of 115, potassium of 3.2, urea of 60, and creatinine of 1.4. So what is the cause of his hyponatremia and what tests will you do and how will you treat him? Okay. Try to think about the question and about the case, and then we'll come back. So this is second case, 45-year-old man who is a chronic smoker. He's admitted with cough and shortness of breath and weight loss. He has loss of appetite and has been feeling more drowsy and somnolent for the last few days. And his X-ray shows a lung mass and the biopsy confirmed malignancy, that is small cell lung cancer, and he's supposed to start chemotherapy. But he's somnolent when he's drowsy, he's sleepy when you go to see him. And his sodium is very low. Sodium is 110, potassium 3.6, and creatinine 1.1. So coming to the second case, what do you think the cause of his hyponatremia is in this case, and how will you evaluate and treat him? Okay, so think about it, and then we come to the third case, and then we'll start the topic. Okay, so the last case, this is a 65-year-old man with heart disease and had a MI 2 years ago. He had a stent put in and now has breathlessness on exertion, New York Heart Association class 2, and he has evidence of congestive heart failure, as you can see. He has pedal edema, he has elevated JVP, he has crepitations at the lung bases, right? And his sodium is 122. He also has hyponatremia. All our 3 cases have hyponatremia. So ECG shows left bundle branch block, and chest X-ray also is suggestive of congestive heart failure. So what do you think is the cause of his hyponatremia? What are the tests you would do, and how would you treat among the choices that are there in front of you? Okay, so these are the 3 cases, different clinical scenarios, all presenting with hyponatremia, but the cause is different in every case, and the treatment accordingly will be different in every case.